Hello everyone, it's a lovely sunny day here in Morgantown, so I hope on whatever day you're watching and listening to this lecture that it's sunny, and if not, maybe you can capture some of the energy. This is Dr. Z, and I want to take you through the first slides in the first unit. And this podcast, you'll have an opportunity, you can re-listen to it, you can play it back, and so if I go through something too quickly, the good news is you can rewind it and check it out again. But the whole point of doing audio over top of the slides is to help you understand the concepts a little bit more deeply and to give you a little bit closer feel for what an actual course would be like. Obviously, the online class, there's a lot of the interpersonal elements that are missing, and in sports psychology, that's reasonably important. In Unit 1, the big emphasis here is really on understanding the theory. One thing that differentiates a sports psych professional from a coach or from someone else who really doesn't understand sports psychology as deeply is we would have theories and formal ways in which we would explore client interactions and informal ways in which we'd understand what is happening with an injured athlete. And so we should be able to do that in a much more structured way, in a much more organized and efficient way than someone without that training. And if you're an ATC listening and taking this class, you can imagine how things were different when you were doing your free hours and just observing and just watching what was happening versus after you learned all of the assessment models and understood how to do injury diagnosis and exercise prescription. You have a checklist that you go through and a way to organize your thoughts. Well, that's really how psychology works as well, but just many people who take this class initially are not familiar with that. So let's look at first unit and let's have a look at some of the content that we're going to be going over in the next hour or so. Each of these unit lectures, you can expect to last somewhere between 45 and 60 minutes, plus or minus a few minutes. And if there's any interruption, I do apologize. I'm recording this from my office here in the Coliseum, so I'll try to pause if we need to in time and then just resume that. So I apologize in advance for any interruptions. One of the first things we're going to do in this class is just understand a bit about athletes' reactions to injury. What are some common reactions to getting injured? What are different areas of their life that are impacted? And then we're going to look at three separate models, one of which deals with the mind-body connections, the second of which deals with risk of injury and how psychological factors contribute to risk of injury. And then the third model deals with how psychological factors influence athletes' reactions post-injury. So the first one, the biopsychosocial model, and the psychoneuroimmunology, the PNI, are going to help us establish the mind-body connections, and we'll talk about those first after we hit some of the bigger topics up front. Now, if you pause for a moment, and maybe many of you have been injured or you've been around athletes that have been injured, what are some of the areas of the athlete's life that you think it has a big impact on? One of the first things that it affects, which is somewhat obvious, is their physical functioning. So depending on the injury, if this is a serious injury and they're out several weeks or they're out for the rest of the season, then they have a semi-permanent disability to deal with in the form of a cast or crutches or a sling, or some type of cognitive disability from a concussion. So physically, there are a lot of things the athlete has to deal with. What would you think are some other areas? So just take a moment, maybe jot those down. And while you're doing the lecture, while you're listening to the lecture, I would encourage you to, you could of course print out the slides or take some comments as well, but I would encourage you to take notes for things that help you explain the theories or the concepts a little bit better to support those notes you're taking from the readings. And in my opinion, it would be best to do some of the readings for each unit prior to going through the lecture, but you're welcome to try it both ways if you want to spend the time. All right, what would be some of those other areas? Let's take a look at those areas. We mentioned the physical area. The one we didn't discuss previously was pain. Pain's an obvious signal, and one ways in which injury differs a lot from other things that happen to us in our life. So if we have some relationship issue or we have someone in our life that's meaningful to us die, those are purely emotional and psychological issues, whereas this, an injury is a physical concern that may result in temporary limitations, permanent physical changes, and you just have to manage the pain, and a lot of athletes will manage that quite well. But that physical signal of pain is something that differentiates an injury from other things that happen to us in our life. Also similar to maybe like a car accident, you would have to deal with that type of issue. Now, some of these other areas of impact, socially, the injury has the impact to reduce the status. If you'd imagine maybe a starter on one of our big sports teams here on campus who would lose that status of a starter to an injury, and particularly for several weeks or an entire season, that's a significant loss of status for that particular person. And depending on what are the consequences of the injury, if they need to have surgery or if they need to be away from the team, they may have separation from their primary support network. They may have to depend on other people for a ride, for help, and oftentimes athletes are highly functioning people pre-injury that are very fit, very strong, very independent, very confident individuals. And so sometimes an injury can be a very frustrating process. I recently had a client who had a fairly serious injury, and one of the biggest frustrations with this person's injury afterwards was that her mom was around a lot and was helping her. So you would think it would be such a positive support, but it really frustrated this person because she was such an independent individual. She really struggled with her mom wanting to be there for a couple weeks and really help her out and take her to class and to practice. And so, that's an area that certain athletes definitely struggle with depending on their personality. Emotionally, we're going to spend a whole unit in Unit 2 on this topic area. The trauma of the event can occur for some. It would depend on, of course, how traumatic the image is of the event. There can be some post-traumatic stress in some of those situations. The most common emotions that athletes will experience will be depression, some anxiety, pain, of course, and then anger. Those are very common things that if you are a sports medicine professional or if you're working with people, you should expect to see those things. They are normal reactions. It just depends on how long they occur, and we'll get into that unit in a couple weeks. Of course, there's threats to future performance, loss of a role on a team, could be general energy levels, motivation to perform. There is an emotional reaction to having to deal with the stress of injury. And then in more severe injuries, where folks are out several weeks or lose a season or lose a career, then self-concept and issues related to athletic identity are highly relevant. They may need to change their season goals, they may need to change their life goals based on what has occurred, and it may have a dramatic impact on them, and it kind of ties over with the emotional area. So there can be it's not to say that injury will always impact all of these areas. That's kind of a worst case scenario, but so kind of a checklist to see what's going on, how are they doing with their support network, how's the pain, how are they dealing with the physical limitations, what's up with their athletic identity, is that a helpful thing or a hurtful thing, and then what kind of emotions are they experiencing. Now, in the different spheres of an athlete's life, we want to check to see how many of those spheres are being impacted by the physical injury. So this diagram, which is called a Venn diagram, if you imagine the white circle in the middle as the injury, in this case it would be bleeding over into affecting 3 other spheres of the athlete's life. One of those areas might be the physical component. Another might be their academic performance. So if you imagine an athlete that's kind of depressed from the injury and now they don't really want to go to class, they don't feel like completing their homework assignments, it's starting to negatively affect another area of performance. So obviously the injury affects the physical performance. Can't run, jump, throw as fast as you might want to do that. But the more domains outside of athletics that the injury is starting to have a negative effect, then the more difficult time the athlete's having coping with the injury. If it's starting to, for example, affect the family and now the family's arguing about what to do with the injury and how to treat it, or if it's affecting teammate relationships or relationship with the coach in a negative way. So the more negative influence that goes out into the different spheres, the more difficulty the athlete's going to have coping with that injury and the more negative impact of the injury. there's quite a bit of research out on grief and mourning and how this process may be similar to getting injured. And this would be particularly for acute injuries that are fairly serious. Grief in general is the reaction to any loss that you might occur. It could be a relationship issue, divorce of the parents, moving away from a house that you've been in for a long time. You could be mourning anything that was positive in your life, including injury. And the thing that makes this concept relevant, or this idea relevant in working with college students or high school students in particular, or even a lot of young professional athletes, is that, as I mentioned before, these are typically very high-functioning people physically, who have high confidence, like to set goals, are very competitive, and have had a lot of positive things go well for them. They're very blessed individuals generally. And they had very little experience with serious injuries, serious loss in their life, and certainly, realistically so, feel reasonably invulnerable because things have gone so well and they're so physically dominant relative to many other people. So grief can feel very unusual to these folks. However, one thing I want to emphasize is it's a very natural reaction to loss, to losing something, and to not have that reaction to a fairly serious injury would be a strange thing. So you should expect, if you're working with injured athletes as a coach, as an ATC, you should expect to see some grief reactions, maybe wanting to be by themselves, not wanting to be around the practice environment, feeling a little bit down, not quite like themselves. You should see that. And there's a series of stages that athletes typically go through in dealing with injury, and that's the Tunick, Etzel, and Leard model on your right. Let's first go through the Kubler-Ross model on the left. This woman was a psychologist, and she did her life's work basically on how people cope with other people in their life dying or their own mortality. Quite a pleasant thing to think about, I'm sure, for each of us. But she devoted that, and she actually wrote a book called On Death and Dying, and this particular model of response to grief is widely accepted as a pretty strong and valid research model in response to grief. Now, it doesn't apply directly to the injury experience as much, I don't think, although you'll see it in the athletic training literature quite a bit. Let's just go through each of the stages and talk about what the athlete's thinking in each stage. In the denial stage, in a response to grief, they're not even really, they don't want to think about it. They didn't happen, and they don't want to think about it. No, this can't be, it did not happen. And it's similar a little bit to the shock stage in the other model. It's just, what happened? What are you talking about? This can't be. So they can't even wrap their heads around that. Moving on to anger, realizing that this might have occurred, now folks get angry. Why did this happen? Why God? Why did this person get taken away? Why did this have to occur? It's not fair, and just there's a lot of, and that's certainly a negative emotion, but a natural response in this case when something is taken away from you. Bargaining can begin, and this is where the person starts to move towards acceptance. They will bargain with God, parents, coaches, and anything they can just to return to that previous state, whether in a grief situation, to just return that person to them. If they could talk to them one more time, if they could see them, what they would give to do that. If they could just plan this next game, then they'll go get surgery. After they give up bargaining, depression sets in. So in this case, folks start to really feel the weight of it. Some things may have occurred that really make it sink in. A few days have passed or moments have passed, and they just need to sit in that depression before they can move forward to acceptance. If a person in a grief situation does not allow themselves to experience depression, at least for some period of time, then it's unlikely they'll be able to accept and move forward in a positive way in their life. Looking at the response to injury model from Tunick, Etzel, and Leard, and Tunick is a colleague here at WVU over in counseling psychology, and Ed Etzel, as many of you know, is our psychologist for athletics here. They modified some of these stages to be more sport specific, sport injury specific. And that second stage, realization, is when they have already been diagnosed by the ATC, or they got their MRI results. That's a stage when, I got to deal with this. So the difference between a physical injury and a grief response is that when you have an injury, some things are pretty obvious. You cannot run. I mean, it really hurts to walk, or you can't throw. You can't raise your arm above your head. So the realization stage is, you know what, I got to deal with this. And so you proceed into mourning or depression a little bit more quickly with a physical injury, because it's not so easy to play tricks on your mind and, picture a person that you still want to be around. So you move into mourning pretty quickly, and acknowledgement of, okay, hey, I have some role in this. What do I need to do to deal with this, to move forward? And then past that, coping and reformulation is reformulating goals, and then putting some positive energy into rehab, like, okay, I'm ready to go, I got to deal with this, I wish it didn't happen, but so that's a fairly realistic phase that they get to at the end, and now they can invest. So the application of this, if you are a coach, an ATC, or anyone else working with athletes that are injured, you got to figure out whether or not they progress through these mental stages before they're ready to do the physical part of rehab. So are they actually ready to do their rehabilitation? And you can do that through having conversations with them, and we'll certainly get into that more later on in the course. Some of your readings that are on reserve on eCampus come from a book by Jim Taylor, and co-written by his dad as well. And this is a sports psychologist that has done a lot of interesting writing, and they never produced a second version of this book, I guess low demand, but it's really an excellent book if you're a sports psychology student, or if you're really interested in this area as a sports medicine professional. As a coach, has really a lot of good sports psych stuff in it. And one of the things that they recommend in terms of working with athletes is that you help them figure out and correct the expectations they may have for how recovery from their injury will likely happen. And one of the key concepts that they introduced to me in this book was this idea of what they call healing cycles. So oftentimes athletes going into injury have this idea that it's just a linear progress, that every day they'll get better, stronger, there's no plateaus, and it's just going to be a smooth, steady climb to recovery. And in reality, if you've ever worked with any of these folks, or you've ever been injured yourself, there's hills, there's valleys, there's days where you improve, there's weeks when you improve, there's days when you don't, there's weeks when you don't, particularly in longer injuries. So they need to understand from the outset that they should expect to have progress, but there will be setbacks, or there will be cycles where they need to rest. But oftentimes athletes have fears about rest, and they think it's wasted time, particularly if they're from like a training heavy sport like swimming, running, wrestling, cycling, where more training is better and they feel like they're losing conditioning or whatever. They may not value rest. It's also important to help them understand that certain psychological issues are more likely to occur depending on the course or the change of rehab. So early on, if you have a look at this bullet, the third bullet, pain and anxiety over what's happened are initially key concerns for athletes. Then in the middle, maintaining your focus and motivation, particularly over a longer rehab, are also key concerns. And then later on, confidence is key with return to sport. There's an excellent article from the athletic training literature. This article was published in Journal of Athletic Training in 1996, that suggests that how you manage athletes psychologically should just differ simply by how long they're out. So if they're only out a couple weeks, you help them manage the stress, the additional time demands of rehabilitation, and then you teach them what they call, a term I don't really like, systematic rationalization, which is basically to focus on the things that they find controllable and not spend energy on the things that are uncontrollable. For example, they can control how and when they show up, how closely they follow the instructions of the ATC or the sports medicine provider, how much effort they put into it, how often they ice and rest, all of those type of things. They control their attitude, their mood state, They do not control when they got injured, the timing in the season, exactly how quickly their body's healing, all of those type of things. So just simply to invest energy into the things that rationally they have some control over. If the athlete's out greater than 2 weeks, then these authors suggest adding some goal setting and then also some support groups so that they can have a shared experience. Getting a rehab partner has been a really great strategy around here. We have some groups running now that just injured athletes can talk about what they're dealing with and kind of compare notes and know that, hey, other athletes on this campus are injured. I'm not the only one having to deal with it. And so it just makes the process seem more manageable. It changes their appraisal of that situation. In the third level, if they have to withdraw from sport, and this is obviously a huge gap from being out 3 or 4 weeks to be having to withdraw from sport, they recommend career counseling, which is true. That can be a very useful thing depending on if you're working with college athletes or certainly with pro athletes. But I would also suggest that in level 2, an individual consultation with somebody, a counselor, a sports psych person, should at least be offered, not necessarily required, but a lot of folks might have the time to take advantage of that and to help them develop a plan to recover psychologically as well as they're physically recovering. In the team, to rehabilitate an athlete, well, there's a variety of people that can have access to them. If you had to guess which of these support people is used most likely by injured athletes, who would you say is the first group, I guess, that they reach out to? Is it the athletic training staff here? Is it a sports psychology consultant if they have access to that? Maybe a coach? Do they reach out to their family members, their friends, their team first? Who do you think? Typically, athletes are going to first reach out to their support members in their family. And from there, they're going to reach out to other people to get help that they need. So, of course, they're going to get emotional support from their family. They're going to get that from their friends as well. They might also get tangible support from friends or family, getting rides and insurance coverage and those type of things. And then they're going to spend a lot of time with sports medicine professionals, particularly if it's a daily type of rehab. And they're going to seek out a variety of types of support from athletic training staff. Particularly here on this campus, and in any college setting, basically coaches require athletes to be at rehab, and so there's not a lot of problems with adherence. There may be a problem with effort and attitude and other things, but they're basically required to be there or they're not going to have any opportunity to return to play. Coaches can be supportive. Some are not. Some basically ignore injured athletes. Some do a very good job. And then sports psychology consultants can be used in a collaborative way. And this typically works well if the sports psychology person is already embedded within a team context and working on team issues, and then already has a relationship with that person. And basically, if you ever want to be helpful to an injured athlete, having a pre-existing relationship with that person, knowing them prior to injury, is probably the most helpful thing in terms of being a useful support person. The summary of these models, and in terms of the stage models and the different grief reaction models, suggests that they don't work that way for everybody. They're useful concepts, the idea that you do need to be psychologically ready, but not every athlete's going to move through the stages in the same way. So what we're going to look at are what called cognitive appraisal models to help us understand the factors that contribute to how an athlete appraises or thinks about their injury. This is another one of those beautiful psychology terms that a lot of people never really understand and you would never use with an athlete, is cognitive appraisal. So what do they think about their ability to cope with this injury? And that particular complex reaction, whether or not they can handle it, will in part predict their emotional and behavioral responses to the injury. So let's go ahead and look at some of these models. One really interesting field of study that emerged out of the 1980s, so it's been going around about 25 years now, you might think of as holistic medicine, mind-body medicine. It's called psychoneuroimmunology. So you do have a reading from this area in your unit. I do encourage you to check it out. It's a very short article that introduces this topic. And if we break it down, it's literally psychology, neurology, immunology, all infused together. So the psychology part of it would be your brain, your thoughts, your attitude, your personality is directly connected to neurology, neurotransmitters, the chemicals in your brain that regulate your mood, and then your immunology, which is, of course, your immune system. So the interactions here on your immune system between how you think, your attitude, the images you have will affect directly healing and rehabilitation. So the mind-body connection is critical in this whole psych of injury idea. And so one thing that sports psych professionals are trying to do, and I certainly encourage coaches and ATCs to do this as well, is to help athletes develop a kind of what we would call a disease-resistant or a positive attitude or a positive personality when they're dealing with this injury process. And we're going to talk about what that looks like on the next slide. Some of this research has been driven by a guy named Bernie Siegel, who in the 1980s, before cancer treatment was very advanced, spent a lot of time studying cancer patients who were exceptional, who somehow beat the diagnosis of cancer prior to when they had invented such vigorous treatments. So some people were simply, it was not coming back, or they were beating it, and the doctors and surgeons didn't understand why. So they started to interview these folks, and they found out some characteristics of these exceptional patients. So these patients had a purpose in life, and they wanted to get back to it, so they didn't just immediately play the victim and assume they're going to die. They were open and they listened. However, they were reasonably confident people, and they would not accept the fact that this was going to beat them. So they were somewhat hostile, would express their opinion, they had high self-esteem, and they really valued themselves. They were not passive or docile. That's what docile means. They didn't play the victim, the patient, oh, woe is me, I have cancer. They were ready to attack it. They were self-reliant, and they wanted to seek out support and do whatever they could. And a quote from one of them was basically, pessimism is a luxury I can't afford. In other words, they don't have time for that. They were going to take every possible advantage. If it was going to give them 1%, 2%, 10%, 50%, they were simply going to do whatever they could that they could control to make that work. So these patients, and these are attitudes we can encourage in injured athletes. You know, I would argue that facing the diagnosis of cancer is a heck of a lot scarier than an ACL or a shoulder surgery. So if these patients can deal with getting breast cancer, colorectal cancer, and battle that, then we should definitely be able to help athletes deal with having an injury that is, not threatening their entire immune system. So some useful information to be drawn here in big picture, how to help them have the right attitude, particularly dealing with a major injury or a major series of injuries, how to be an exceptional injured patient. Some of the interventions that come out of psychoneuroimmunology are support groups, relaxation imagery, mindfulness, and changing your self-talk. So developing hardiness means you start to develop this idea that yes, you can handle this. This is going to make you tougher. You do have the ability to handle it. And it's a reasonably aggressive attitude. Folks are not going to accept the fact that, okay, this is going to knock me out. This is going to take me down. And so athletes, I think, can relate to that idea. But sometimes we're very discouraged, of course, by the loss of goals or by loss of conditioning or plans they had. But frankly, those plans don't matter. Like once you're injured, the plans you made 4 weeks ago, pre-season, or any time, don't matter. So at some point you got to say, you know what, that's going to go down the river. That's one of my favorite analogies. It's done. You can hold on to it all you want, but you need to work with what's currently in front of you. And so social support can really help that, because it feels like other people are having to deal with it. It gives you the sense that yes, I can deal with it too. We're going to spend the last unit talking about those support groups and then relaxation imagery techniques that you can use with injured athletes, and a lot of them really find this stuff appealing because it's portable. You put it on your iPod and you can do it while you're icing, while you're resting, while you're doing e-stim, any of those things. Body awareness or mindfulness, being in the moment, and what we would call an Eastern orientation as opposed to our Western orientation here in the U.S. And then I would suggest to a lot of you that are trained in the medical model or don't necessarily buy into sports psych very much, that the placebo effect is basically all you need to know or believe as to why the mind can control the body. So if you're not familiar with this, the placebo effect is in all research, drug research for example, there's a control group that gets a pill that is not the intended drug, and there's a group that looks just like that gets the actual drug. So over time there has been shown you must have a control group because you need to counteract the placebo effect, which means folks think they're getting something that's working. So whether that thinking that it works gives you 10%, 20%, 30% of the actual medication effect without taking the medication is amazing and is present in nearly every circumstance. And they've done studies, for example, on college students, serving them alcohol or another thing that seems like it's alcohol, and they will even play out the placebo effect when they're given, a 7-Up that they think has alcohol in it. They will begin to act as though and play that out. Now that's kind of a stupid example, but the idea is if I'm given a cholesterol medication, or I'm in a study on cholesterol medication, I may be able to improve my cholesterol simply by believing that I'm taking a pill. Now if that's not an example of the mind-body effect and the ability of the mind and how I think and the images I create to take over my physical system, then I don't know what is. So it really doesn't matter whether it's a 5% increase, 10, 20% possibility. Like, why would you not encourage the people that you're working with to take advantage of that effect? So you could argue that ethically, if you don't do it, that you wouldn't be giving them the full shot at quickest recovery, in my opinion. So with all this, holistic stuff, even if you're not buying into all of it, who can do it? Is this something that ATCs, coaches can do it, or is it left for the MDs or the sports psych consultants? Well, there's been some writing on that area, and a couple colleagues of ours here from WVU, Joni Kramer-Rowe works up at Cal University of PA, and she teaches in the athletic training program up there, but she graduated down here with her doctorate in sports psych. And they suggest that, basically a lot of athletes who are going to have depression and anxiety, and that will impair their immune functioning and recovery after injury. A lot of interventions can be used to target these problems and also help them with pain management and stay motivated for adherence. The issue that they point out is that counseling really is a core competency, not an extra competency, not an adjunct, basically a core competency that all ATCs should have, but they feel less competent. So the way the NATA is structured, all of the testing is, of course, you do get tested out and you pass and you're considered proficient or certified. That's literally ATC, certified, but that doesn't necessarily make you good or competent in it. It's just a base of competence, a certification. And oftentimes, compared to other areas of athletic training, counseling and psychological issues is one of the weakest as rated by ATCs. Let's address a couple questions. Who can ethically provide counseling? Really anyone. It's just a matter of how efficient and how effective you are at doing that, and in getting some training. But basically, if you're working with athletes as a coach or an ATC, you're going to be involved with it. If you're a strength coach, you're going to provide some counseling, just how much you choose to do on your own. Do injured athletes need counseling or sports psych? No, very few need it. We need literally to breathe, to eat, to be loved and accepted, to sleep. Those are needs. Okay. Could a lot of athletes use counseling and sports psych? Yeah, it could benefit them. What do you think, if you take a moment, what is the biggest thing, the number one thing that sports psychology services could offer injured athletes? If you just take a moment and think about that. So if someone had the opportunity to work with a qualified professional, someone who's ASP certified or a licensed psychologist with some training in sports psychology, what would that athlete potentially get out of that? The number one thing, compared to just going through rehab, working with competent sports medicine professionals and surgeons, doing the sports psych thing in addition to that. So take a moment and think about what that might be. So did you figure it out? That's the question. Well, the number one thing they can offer them is time. So certainly sports psych professionals and psychologists in general, if they're well trained, basically they're gonna help an athlete reach the destination in a quicker amount of time that they would have reached on their own. They're going to provide a roadmap to get to that destination in hopefully the most efficient or a very efficient way. Versus if we walk that path on our own in life, I truly believe life's a very good therapist, and we'll basically get over everything in time. But athletes oftentimes don't have unlimited time. You might have, let's say you're a senior football player, you might have only that year to capture the eye of scouts and get drafted. Maybe that's your window. So making it back for the Senior Bowl, making it back for that bowl game might make the difference between the 5th round and not getting drafted, the 1st round and a 5th round. And so the time of getting back 2 weeks earlier, 10 weeks earlier, 3 days earlier can be hugely beneficial to athletes, where it may not matter in the general population. So if you're helping someone with, let's say they're having a depression issue and they get healthy in April instead of March, maybe for them in the grand scheme of things, that's still a good outcome. That's no big deal because nothing in March was affected, by still being depressed. But for athletes, they don't have that luxury. There's only a few years to capitalize on being young, fast, strong, getting seen, maybe getting a college scholarship versus not. Those things can make huge differences. So sports psychology to injured athletes, the benefit is time and the potential for a straight A to B path versus a meandering. But we should never send the message, in my opinion, and I've worked with a lot of athletes, that athletes need it or they need sports psych, because they don't. They have the skills already. So I'm simply the GPS to provide suggestions to guide them along the way. They still need to drive the car. Okay, they still need to maintain their car. Okay, I'm just providing the roadmap for them on how to do that. Otherwise, they'll get there one way or the other. What can sports psychologists offer sports medicine providers? That's what SMP is down there. Well, they can offer them quite a bit. And one of that is just, I think, to me, the difference between competent and good and between good and excellent. I certainly think there's plenty of really good ATCs out there, and most of the students I've had in my courses in the master's program have been very good. And a lot of the undergraduates I interact with here at WVU are also very good by the time they get to their senior year. And some of them are very good, kind of psychologically minded folks. Others are not very good at that. And so getting some additional training will simply help you be more organized in how you work with athletes. And you'll be better at your job. It's not going to replace your training. It's going to enhance it. Same as coach. I'm never going to tell someone how to train their athletes if they're the swim coach or the lacrosse coach or whatever. That's not my expertise, but I might be able to complement those skills and help provide suggestions on how to help motivate certain types of athletes or deal with certain situations that will simply make them more competent and improve, hopefully, what they do and be more efficient in working with individuals, which is ultimately what we all do. Even when we're working team situations, we're working with individuals. So hopefully that stuff makes a little bit of sense. Just a few stats from a classic from the athletic training literature. This was published a while ago by some colleagues up at Boston University. You can see in this study, about 25% of ATCs had referred an athlete to counseling. I'd say that's probably a little bit higher now. And 75% did not have access to a sports psych professional. I'd say that's probably 50% now. In terms of the major schools, probably between 30 and 50% of them will have somebody around that they could refer to, even if it was a counseling services on campus general. I would say almost 100% of ATCs now will have taken a psych class, but that psych class unfortunately is usually 101 instead of sports psychology. And if you've taken Psych 101, it's not going to help you be a better athletic trainer at all, in my opinion. It's just not going to do enough. It's not specific enough. A lot of ATCs, I mean 85% are reporting sports psych's important to their training, but it's just like what athletes say. Athletes are going to say that the mental game is important. However, they don't really spend that much time actually practicing or learning it. So it's the same with ATC. They believe it's important, but they're not really seeking it out and not getting that additional training. And if you're lucky enough to get a sports psych class, I think it's an advantage that you should talk about on interviews. You should be able to talk about it in a different way from those students. So summarizing this part before we hit to a couple models, this process is a little bit complex in terms of how injury impacts individuals, and individualizing how you assess and treat is fairly critical from a psych perspective. However, there are certain models that help us understand how the situation and the person, characteristics of the situation and the person, are going to interact, and so that we can understand how those characteristics influence how someone recovers. So let's look at those. Let's look at those models to get a little bit more detail. One of the first models that's really helpful in terms of predicting injury risk and identifying those athletes, for example, in the preseason who might be more at risk to get injured this season, is called the Stress and Injury Model by Williams and Andersen. This one is detailed in your book, in your Ray and Weise-Bjornstal book. And the basic premise here is that those folks who have been stressed, have undesirable personality characteristics, and low coping resources are more likely to be have more activation under stress. Basically have a higher volume and experience a higher volume of stress. Okay, and that higher volume of stress activation will put them at risk to get injured. Undesirable personality characteristics refer to a lack of hardiness, being neurotic or really a worrier, someone with a high anxiety personality. Also someone perhaps that has a lot of tension and anger, a type A person, a perfectionist who has a lot of anger associated with not doing well. And then someone with low coping resources, so they don't really react well to stress, they don't have a lot of social support, those type of issues. And you should definitely read more about that in your textbook as well. The basic model looks like this. You have the three pieces at the top that we just discussed influencing your stress response. And that is the cognitive appraisal, or how you're thinking about the injury, and then the physiological and attentional changes that result from that cognitive appraisal. So the physiological and attentional changes refer to, under stress, what's your experience like? Physiologically, is it cranked up? Are you experiencing a lot of that, the symptoms of stress? And then attention can range from basically moderate stress to panic, full-on panic. And when you have full-on panic, you're basically ignoring a lot of stimuli outside of what you need to. So if you're in a sports situation and you're distracted, for example, worrying about something that occurred last week, you might get crushed by someone, come and try to tackle you, take the ball away from you. You might be hit by a pitch, so you're just simply not there mentally, and you're exposing yourself then to risk of injury. On the bottom are interventions that may be taught to modify those cognitive appraisals, self-talk interventions, thought stopping, and then relaxation and imagery that may be taught. After about 2 decades of research, this model was actually started in 1988. The strongest paths are history of stressors and coping resources. We do have a fairly confident that those people with a recent history of stress or major negative life events are going to be experiencing more stress in their lives and may put themselves at risk in a sport environment to get injured. And those without social support or without good coping skills, and those coping skills also include your ability to maintain your nutrition, your sleep, your training habits, like your basic activities of daily living in a positive way, water intake, caffeine intake, all of those type of things, so that you're managing your own physiology, basically. So those are the strongest areas. And probably since this study came out, which was 98, there's been a lot more research in the intervention area. So probably this area is stronger now than it was before. And there's been a lot of good evidence in the literature, some of which you'll read for one of your first assignments. So I would suggest that this is probably a little stronger than I have it now. It's probably at least a solid color, but maybe not gold. Now the other model that is in your textbook, and one of the, you'll recognize the Weise-Bjornstal name that they have put out, relates to response to injury. The good part about this model is that it integrates the Williams and Andersen, and they've basically looked at all the literature and shoved in all of the personal and situational factors that may affect how an athlete appraises their injury. So let's look at some of the pieces of this. But let's first understand cognitive appraisals. I think I mentioned it before, but let's make sure we're on the same page. Negative appraisals of injury, and that's basically anything that relates to the theme of, boy, I can't really handle this, this is overwhelming, I don't think I can deal with this, will have a major impact on your mood disturbance, meaning you're going to be more depressed, angry, anxious, all those negative moods that we've been talking about. So those negative perceptions influence then feelings and behavior. So that the traditional kind of what we would call cognitive behavioral psychology, you have your thoughts influencing your feelings, which then dictates your behavior. So just as an example, you might have an injured athlete thinking, oh my God, I'm overwhelmed here. I got to deal with getting surgery next week, and I'm still in my classes, and I don't know when I'm going to have time to deal with that, and that sucks, and what happened to my season, and having a lot of really negative attitude towards that will obviously be feeling stressed. So they'll be anxious about the surgery, they might be a little bit down, they might be socially avoidant, they're going to have some really negative feelings, and then their behavior might be, you know, I need to forget this, I'm just going to go out and drink. So they might seek out a behavior just to manage all those negative mood states, or they might just go home and they might quit the team for the season. So those feelings, because they're panic and they're very overwhelmed, is going to predict a certain type of behavior. Now, that's a somewhat extreme example, but that's the idea, that's the flow of it. So let's look at the full model for cognitive appraisals first, and then we'll look at the Weise-Bjornstal piece. So the cognitive appraisal process is this weighing of, if you imagine the teeter-totter, the seesaw here, the individual's perception of their own resources, and that's on the left side here. So this is my perception of my own personal and social resources, any positive consequences that might come out of this situation, versus the situational demands and how hard the injury and how painful the injury and how long I'm going to be out and what are the negative consequences, what have I lost. So really there's one of two versions that can occur. In this situation, the person perceives that their resources outweigh the demands. And they're then in that case, of course, not going to experience substantial stress. It might still be a very difficult situation, but they feel very confident, they have good support, they've got a good plan, they've got a good athletic training staff, they feel good about it. So even though it's a very difficult injury, they're going to manage it and they can deal with the stress. On the flip side of that is a person that perceives the opposite. They believe the demands of the situation and the negative consequences outweigh anything that's positive. And remember, this is totally perception. That's the beauty of psychology, really, is that depending on a conversation or a particular intervention or a therapy session, they might be able to change from this negative interpretation of the injury to a more positive. They don't need to be Pollyanna or happy, I love the injury, this is fantastic. They simply need to get to a situation where they believe they have enough support and resources to manage it so that it outweighs what they're being asked to do. Because otherwise, you're creating a situation that looks a lot like panic and a lot of stress. It's going to make everything more difficult. Now, in the full model, if we start up here at the top, let's look at this in animated form if we can. We can't. Sorry about that. The factors from the Williams and Andersen model here start at the top. You'll recognize those. So those influence the likelihood that you actually get injured. Once you're injured, a variety of personal and situational factors are going to influence then your cognitive appraisal, what we've just been talking about. So as an example, under personal factors, this could be, of course, the type of injury, the severity of the injury, when it occurred, personality, attitude, previous experiences, all of that stuff. And there's a full listing in your textbook of all the factors that they've thought about here. On the situational side, it would be, you know, the sport. I previously mentioned timing and season. That would be a situational factor. I'm sorry. Social elements, loss of status, environmental stuff related to the injury, when it occurred. those things influence the cognitive appraisal. So it's both factors of the person that they bring in, and then the unique situation in which the injury occurred. The timing of it, the team, the coach situation, all that stuff influence the cognitive appraisal. So it's a very individual process. So as a psychologist, you come in and you try to get a sense for this, know the person, know the context. That would help you determine the cognitive appraisal. And then that cognitive appraisal mediates these two other things here, the emotional responses and the behavioral responses. So the second unit, we're going to focus on the emotional response, spend some time on that. And really in the third unit, we're going to deal with adherence and rehabilitation behavior. So we'll explore all three pieces reasonably thoroughly in the class. One note I want to make about the emotional response is that it's not common that an injured athlete, even with a severe injury, that they will experience some sort of clinical reaction or need, inpatient treatment or medication for a psychological reaction. In fact, most of the literature suggests that's low. Less than 20% of athletes will experience that. Most of them actually cope quite well. And what you can expect is athletes for a couple of weeks should be down, should be out, should not be themselves, but certainly after 2 to 3 weeks or a month, they should be pretty much back to normal, back to what they were like prior to the injury emotionally. And be dealing with it okay. Doesn't mean they like that it occurred, doesn't mean they're happy-go-lucky about it, but they cope fine. And the literature on that suggests that even in career-ending situations, most folks cope fine without seeing a psychologist. It may take them some time, but they do cope well. And also on the flip side of that, it is important to realize that sometimes being in a bad mood motivates you to do something else. So if you're grumpy about the being injured and maybe you're a little depressed and you're just sick of it, you're like, okay, I'm sick of this, I need to fix this and make sure I don't get injured again. So maybe it motivates them to rehab and get that area of their body stronger so it doesn't occur again. So sometimes negative emotions actually motivate positive behaviors as long as they're not so extreme that they leave you on your couch and all you want to do is sit around and be depressed. So in summary, it's a fairly useful model, to look at and try to analyze a case and try to pick out the things that are important for that individual. The tricky part is that there's so many factors that are mentioned, and if you look at the whole model in your textbook, you'll see how many things are listed under personal and situational. The model itself doesn't dictate what's most important in that particular model, which I guess is kind of the point. I mean, it's going to differ for the individual athlete. So ultimately, if you know your athlete, you know which of those factors might be the most important to them. And it applies to all athletes regardless of how much the injury is affecting them. So hopefully a lot of the concepts in the models make sense from this unit. Send me your specific questions. And the last thing I want to do from this lecture is simply to discuss with you what assignments you need to complete in this unit. You have 2 discussion thread assignments. Just introduce yourself, talk a little bit about your major, why you're taking this class. Are you a minor? Are you a major? Are you ATC? Are you a coach? Are you a sports psych professional? What are you? Where are you heading in your career if you have any idea? And then you have another one, and then go ahead, of course, and see who else is in the class so you know what you're dealing with and who else you can relate to some of these folks. You have another discussion thread article about sports psych in the news related to injury. And then you have your first written assignment, which is an article critique. You're going to pull one of the articles out of the evidence folder. You're going to read it, and you're going to do a review of that article and critique whether or not you think there's any evidence in that article to support the idea that psychological factors influence injury. Please don't plagiarize in this particular assignment. Okay, so even though you are summarizing the article, you should use your own words and be careful to cite things appropriately using APA style. If you're unclear about those guidelines, you don't know how to do that, you definitely ought to drop me an email. But I assume most of you are familiar with that process by now. You have a quiz. Those quizzes, all quizzes are based on assigned readings. And then, of course, assigned readings have been discussed here as well in this lecture. So the lecture and the readings will be the basis for that quiz. And I encourage you to make sure you have read everything and taken notes and have them organized by the time you start that quiz. They are timed. And you can use open books. I have no illusions about students looking over material while they take quizzes online. That's fine, but it's based on the fact that you know it, so you're not given unlimited time to do that. So with any of these things, they're due July 6th. So complete all of these. You can do them anytime. Start them now. And if you have questions about any of the assignments, please let me know, and I look forward to speaking with you in subsequent lectures.